Yes, in this session, we are going to discuss the surface landmarks. The surface landmark. What is the relevance of surface landmark? For example, let me ask you a question. The most important or like most frequent X-ray position we are taking in our department is chest PA, right? We'll be taking most frequently in a day. Maybe you are taking 10 or 50 or 10 to 50, like or more than 50 X-ray will be taking. Chest PA X-ray will be taking. While taking chest PA, where you'll be keeping centering point at the level of T7, thoracic vertebra, right? So you'll be keeping centering point at the level of 7th thoracic vertebra. But how you can understand where is 7th thoracic vertebra? We cannot count, right? T1, T2, T3, T4, T5, T6, T7. We cannot count. Then how we can understand the 7th thoracic vertebra? For that, we have an external landmark, external indicators. That is inferior anguloscapula. At the level of T7, we have inferior anguloscapula. So we'll be understanding by looking at the inferior anguloscapula, that is the level of T7. So that's what the relevance of surface landmarks. Most anatomical structures cannot be visualized directly. We cannot visualize all anatomical structures, especially the vertebral levels, cannot be visualized directly. So technologists must use some external indicators or surface landmarks to position the patient. For that, we have surface landmarks. So in this session, we are going to discuss the surface landmarks or external indicators in the cervical area, thoracic area, and lumbar pelvic area. Yes. So in the cervical area, we have how many cervical vertebrae? We have 7 cervical vertebrae. Right? We have 7 cervical vertebrae. In this 7 cervical vertebrae, at the level of C1, at the level of first atlas, at the level of C1, first cervical vertebra, we have mastoid tip. Keep in mind, at the level of C1, first cervical vertebra, we have mastoid tip. At the level of C2, C3, at the level of second or third cervical vertebra, we have mandibular angle. See here, here we have the mandible. In the mandible, this part of the mandible is called mandibular body, and this part is called mandibular ramus or rami. So the angles created by mandibular ramus and mandibular body is called mandibular angle or gonion. Can be called that gonion. See, this gonion is at the level of second and third cervical vertebra. So at the level of T2, T3, we have gonion or mandibular angle. Gonion or both are same. Gonion or mandibular angle. So at the first cervical vertebra level, we have mastoid tip. C2, C3 level, we have gonion or mandibular angle. Clear? Yes. Next. At the level of C3, C4, at the level of C4 or C3, C4, we have hyoid bone. At the level of C3, C4, we have hyoid bone. At the level of C5, we have thyroid cartilage. At the level of C5, thyroid cartilage. At the level of C1, T1 vertebra. At the level of C7, 7th cervical and first thoracic vertebra, we have vertebral prominence. Here we have the vertebral prominence. These are the important external indicators in the cervical area. Landmarks in the cervical area. You will be getting direct or indirect questions from this area. So C1 at the level of mastoid tip. C2, C3 at the level of gonion or mandibular angle. C3, C4 at the level of hyoid bone. C5 at thyroid cartilage. C7, T1 vertebral prominence. Clear? Yes. Then in the thoracic, now we are going to discuss the external indicators or surface landmarks in the thoracic area. In the thoracic area, we have first thoracic vertebra. Anyway, C1, T1, we have a vertebral prominence. At the same level, we have T1 vertebra. It is 2 inches above the jugular notch. Here we have the sternal notch or jugular notch. So T1 vertebra is 2 inches above this jugular notch. Here we have the jugular notch. T1 is 2 inches above this jugular or sternal notch. Clear? So T1 is approximately 2 inches above jugular notch. And T2, T3 is the level of jugular notch. T2, T3 is at the level of jugular notch. T4, T5 at the level of sternal angle. At the level of T7, as we discussed, inferior angloscapular. So T1, 2 inches above the T1 at the level of 2 inches above sternal notch. T2, T3 at the level of sternal or jugular notch. T4, T5 sternal notch. T7 inferior angloscapular. T9, T10 level we have xiphoid tip. We have xiphoid tip at the level of T9, T10. Keep in mind T1 at the level of 2 inches above jugular notch. T2, T3 at the level of sternal notch. T4, T5 sternal angle. T7 inferior angloscapular, where we keep centering point for chest PA. T9, T10 xiphoid process or xiphoid tip. Clear? Yes. Now we are going to discuss the surface landmarks or external indicators in the lumbar sacrum pelvic area. At the level of L2, L3, we have inferior costal margin. At the level of L2, second and third lumbar vertebral level, we have inferior costal margin. Inferior costal margin means the lower area of rib cage, inferior costal margin. At the level of L4, L5, fourth and fifth lumbar vertebra, we have superior most portion of iliac crest. Superior most portion of iliac crest. At the level of S1, S2, we have anterior superior iliac spine. At the level of first and second sacral vertebra, we have anterior superior iliac spine, ASIS. At the level of coccyx, we have symphysis pubis. At the level of coccyx, we have symphysis pubis. So L2, L3, the level of inferior costal margin. L4, L5, level of iliac crest. S1, S2, anterior most portion, anterior superior iliac spine. Coccyx at the level of symphysis pubis. So these are the surface landmark, external indicators we have to consider. So here we have the full landmarks. C1, the level of mastoid process. C2, C3, gonion angle. C4, hyoid bone. C3, C4, the hyoid bone. C5, thyroid cartilage. T1, 2 inches above the jugular notch. T2, T3, jugular notch. T4, T5, sternal angle. T9, T10, xiphoid process. L3, L4, lower costal margin. L4, L5, and superior most portion of iliac crest. S1, S2, anterior superior iliac spine. Coccyx at the level of symphysis pubis. These are the points we have to remind in landmark. You will be getting direct question from the landmarks. They will be asking what is the external landmark for L4, L3 level, or what level we have xiphoid process. That kind of direct question also we can expect. So I think that is clear.